Susan Orth. I'm from Columbia, Missouri. I went to undergraduate at Creighton University in Omaha, Nebraska, and majored in mathematics. I always knew I wanted to be a doctor since age 12 when I used to volunteer at the hospital where my dad worked, and my dad would call me up at the pediatric floor and ask me to come watch his surgeries, and so I always knew I wanted to be a surgeon. But at the time I didn't know that it would be GYN or gynecology until medical school. And then after medical school at University of Missouri in Columbia, then I went to residency in Houston and met my husband there. What drew me to being an OBGYN is I enjoyed surgery, and I also enjoyed explaining to women the female diseases, and also just the just simple routine exams and what a doctor is looking at with that. And then I also in medical school loved the obstetric part of OBGYN, delivering a baby and just seeing a newborn be born, just the miracle of a baby. And yeah, that was very easy to decide. At first I thought, oh, maybe general surgery, but once I did the OBGYN rotation, it became very obvious that I loved OBGYN. My passion for OBGYN is gradually changing. I've gone from where I thought obstetrics was my main calling to leaning more even toward just GYN, and from more personal experiences dealing with breast cancer and realizing that breast cancer isn't as scary as it has to be, and I welcome the chance to talk about breast cancer and even breast cancer screening, or when patients have abnormalities and are worried. I enjoy talking about it. My philosophy for patient care is that when a new patient comes to the office, that they feel welcome, and that they feel that I'm here to listen to their needs and answer their questions, and also provide them with more information. So being part of a large group has a lot of we have a lot of resources. It is like getting a consult from 5 other physicians. So I feel very comfortable speaking with my partners and getting other opinions, and also finding more resources and answers for patients. I feel that in our office that we do each have different personalities, and I do enjoy partnering with my patients and finding what they're interested in and what they're looking at in terms of for healthcare and for a physician. I enjoy getting to know them and getting to know their family also. Yeah, I do find it very important to be clinical, but also to be personal, and to understand and try to understand what a patient is going through and what they're worried about. I think I found myself going into GYN when I had so many questions about women's health and diagnosing women's diseases. And I do feel that I can explain things in a simple manner if it's something that seems complicated. And I do feel that finding an answer to the treatment that you want, there are so many options, and that's something that it takes a lot of discussing and a lot of looking into different areas. I enjoy being with my husband and my 2 girls in my spare time. I like to run, I like to golf, and I like to play tennis.